Hello everyone, today we are going to discuss on the topic gastric lavage. So what is gastric lavage? Gastric lavage simply means to remove the contents from the stomach. Okay, whatever there is in stomach, if you remove that, it is known as gastric lavage. Okay, so patient comes with a poisoning. Now I have to do gastric lavage. So what would have been the ideal time that gastric lavage could have been done? Okay, or the gastric lavage can be done within what ideal time? So the ideal time to gastric lavage is 1 hour, within 1 hour. Okay, within 1 hour gastric lavage is considered to be very ideal. So the ideal time is within 1 hour. Within 1 hour. However, it can be done up to 4 to 6 hours, but within 1 hour it is very ideal to do gastric lavage. Now, while doing gastric lavage, what will be the position of the patient? What will be the position of the patient while doing gastric lavage? So, patient is usually placed in two positions. One is Trendelenburg position. Trendelenburg position. The other is lateral decubitus position. Okay, lateral decubitus. Okay, and what are the tubes? What are the name of the tubes that are used in gastric lavage? The name of the tube that is used in gastric lavage is Boas tube. Either Boas tube is used or Edwards tube is used. Okay, either Boas tube or Edwards tube is used. Okay, so what are the fluids that are used in gastric lavage? Fluids that are used in gastric lavage. The fluid that is used very extensively in gastric lavage is tap water. It's very easy to get tap water, so the fluid that is used most extensively is tap water. And what are the other fluids that are used in gastric lavage? Other fluids. The other fluids that are used in gastric lavage are KMNO4. KMNO4 is used, and it is diluted in 1:5,000 concentration. But in case of opium poisoning, okay, if there is opium poisoning, in opium poisoning, KMNO4 dilution is 1:500. Okay, so this is a very important point. In opium poisoning, KMNO4 is diluted in concentration 1:500. Okay, if you encounter an infant with poisoning and you have to do gastric lavage, so the fluid used is neither tap water nor KMNO4. Okay, the fluid that you use is normal saline. In infants, you use normal saline. Okay, so these are very important points. Now, what are the contraindications of gastric lavage? In which cases gastric lavage can't be done? Okay, contraindications. What are the contraindications? So just remember 4 C's. Okay, just remember 4 C's. The first C is corrosive poison. First C is corrosive poison. Okay, if a patient comes with a corrosive poisoning, can't do gastric lavage. It can further do damage to the upper structure like esophagus and as well stomach also. Okay, so gastric lavage is absolutely contraindicated in case of corrosive poisoning. But there is exception in case of corrosive poisoning. What are the case in which you can do gastric lavage? So the exception is carbolic acid. In case of carbolic acid poisoning, you can do gastric lavage. Why you can do gastric lavage in carbolic acid but not in oxalic acid or not in HCl or not in H2SO4 poisoning? Because carbolic acid form leathery consistency. Okay, forms leathery consistency in stomach epithelium. In stomach epithelium, it forms leathery consistency. So in carbolic acid poisoning, gastric lavage can be done. Second C is convulsant. In convulsive poison like strychnine, for example, if there is strychnine poisoning, so you should not do gastric lavage. it can further enhance, or it can further cause convulsions. So in case of convulsions, never do gastric lavage. For doing gastric lavage, that means you are again exposing the patient to convulsions. The second C is comatose patients. If patient comes to you in coma like condition or in unconscious condition, then never do gastric lavage. It will lead to aspiration. The fourth C is compromised airway. Again, if the person has compromised airway, then never do gastric lavage. Again, it will lead to aspiration. So these are main contraindications for gastric lavage. The other contraindications are in case of volatile poisoning. In case of volatile poisoning, never do gastric lavage. Like if there is hydrocarbon poisoning, gastric lavage is contraindicated. Now if there is risk of hemorrhage, if there is risk of bleeding, okay, if there is risk of bleeding, then gastric lavage is never done. Seventh one is if there is ingestion of foreign body, then obviously gastric lavage is never done. Okay, so as you can see in this diagram, so this is Boas tube. Okay, this is Boas tube. Can be asked in your exam. This Boas tube. This is rubber tube, and the length of this rubber tube is 1.5 meter. Okay, and diameter is 1 centimeter. Okay, this one is suction ball. It is funnel, and in uncooperative patient, mouth gag is used. Okay, in uncooperative patient, mouth gag is used. So this is Boas tube, and now as you can see, the patient is lying with his head downward and leg upwards, and the bed of the patient is inclined. Okay, so what is the angle of inclination? The horizontal, the angle of inclination of the horizontal is 15 degree. Okay, and it is Trendelenburg position. Trendelenburg position. Trendelenburg position, patient lies at 15 degree with the horizontal, with his head downward and leg upward. So usually this position is preferred in case of poisoning because it prevents aspiration. It's very easy to do gastric lavage. Okay, so this was all about gastric lavage. Thank you very much.